Hello, good evening, everyone. I am Dr. Hina Singla, Program Officer of Vision 2020 India based in New Delhi. On behalf of Vision 2020 India and Dr. BK Rana, I welcome you to this webinar on Accreditation Program for Eye Care Organization, including Vision Centers. Let me introduce our resource person. Dr. BK Rana is the CEO of the Quality and Accreditation Institute, former director and CEO in charge of NABH QCI. He is also board member of International Society for Telemedicine and E-Health, chairman of Documentation Review Committee, and member of Complaints and Appeal Committee of National GLP Compliance Monitoring Authority, DST Government of India. Thank you once again for your participation. I request Dr. BK Rana to take on. Over to you, sir.
Thank you, Vision 2020, Right to Sight India, Mr. Panindra, CEO, and the team for giving QAI this opportunity to speak to the members on very important topic of quality and accreditation in eye care organization. The topic I'm going to speak is about accreditation program for eye care organization, including vision centers. And there are a couple of developments and the new insights which I would like to take this opportunity to present to you all. Before moving to the topic, I just want to uh, let people know who we are and what we do so that they can connect us with the topic and also can make utilization of the services which we offer for improving the quality of services, patient safety, and across the whole care continuum of patient. So QI started an accreditation body in August 2017, so fairly new, a young organization. And we are the fastest developing accreditation body in the whole world. And I say so because we have developed 17 sets of accreditation standards in 6 years. So as I mentioned, we take care of the whole patient care continuum for all three stages of patient journey, pre-hospital, hospital, and post-hospital care. And saying so, we are emerging as a specialist accreditation body because we are developing specific programs for different types of activities a healthcare organization is involved in. And QI is one amongst three Indian accreditation bodies which are operational at the moment. This is our structure. We have four verticals. Center for Accreditation of Health and Social Care is the vertical where we have accreditation program for health and social care. So we are not just restricting to health, but extending to the social care as well. And the board of CHSC is chaired by Professor M.C. Mishra, former director of AIMS New Delhi, and supported by many other eminent people in the field of healthcare quality, clinical practices, and administration, coming from both public and private organizations and also some of the policymakers. This is what we do. So as I mentioned, we have developed 17 standards. And there are one standard which is from WHO. So this is the menu which we offer to our clients, starting from a single doctor clinic to a tertiary care hospital and home care, transition care, rehabilitation centers, telehealth, hotels, dialysis centers, IVF, emergency department, green healthcare, which is very prominent nowadays because environmental sustainability is the talk of the town. So this is the standard which we have already in place to take care of those issues. The stroke center accreditation program, hair transplant clinic, which we just launched a few weeks ago, and the latest program which we launched for medical transport organization, which is for emergency medical services, most commonly known as ambulance services. And that's why we say we can complete the whole care continuum, pre-hospital, hospital, and post-hospital. So pre-hospital is covered by MTOs. And one of the specific program by eye healthcare organization is vision centers. Thanks to Orbis and many other partners which came together to develop these standards for vision centers. And as we speak about eye care organization, so we have four standards for eye care organization, depending on the nature and size of that eye healthcare organization comes from. So we have ambulatory care standards, which covers any type of daycare services, including eye care. If you don't admit patients overnight for clinical reasons, they come in the morning and discharge before night. So they comes under ambulatory care and eye care organizations. Most of the people organizations which are engaged in eye care services fall into daycare services, so they can avail the services under this program. If there are hospitals, eye care hospitals, which admit patients for clinical lesions, they perform surgeries which require some stay in the hospital. And then, depending on the number of beds they have, we have two standards: 250 beds and above 50 beds. So, depending on the nature and the size of hospital, they can choose to go for that specific accreditation program. And fourth one is obviously I just spoke to you about the vision center, which we have added uh, couple of months ago. And so these are the four types of standards which we have to take care of any type of eye care organization interested in accreditation. In addition to the CHS, we also, as I mentioned, Center for International Accreditation. The idea behind showing this slide is because many of the hospitals or likely clinics, they have the medical lab component. So we have accreditation standard, which is not developed by us. It is from ISO 15189, is international standard. So we grant accreditation to medical laboratories using ISO 15189 and also a recognition program for medical labs against clinical establishment standards requirements. Another standard for relevant for eye care organization is because there are few organizations, I'm not aware of India, but abroad, who are also engaged in research and development and they set up biobanks. So we have program for biobank expiry 20387. So we are internationally recognized by International Society for Quality in Healthcare, and QI is the first body receiving this international recognition in less than 5 years of operation. So by getting that achievement and recognition from ISQA, we qualify for CGHS empanelment of hospitals, eye centers, dental centers, and imaging centers, and as equivalent to NABH accreditation standards for these. And CGHS empanels QI accredit eye centers, hospitals, dental center, imaging centers as equivalent to NABH and give the financial incentive. So these centers have a choice to go to NABH or go to QAI. So this is one of the significant achievement which we have achieved. This is our gold seal of accreditation mark and accredited facility entitled to become to use these accreditation mark on their letterheads or their brochures and publicity materials. So we are currently present in 11 countries offering one or the another program. As you can see on the slide, different countries listed over here. And some of the countries listed on the right side is the discussion going on for some programs to be providing there. So we are global organization. We are not restricting our activity just to India, but as you see in the slide, we are global in operations. Now, after this brief interview, we'll move on to quality as we talk about. People talk about quality, accreditation, safety, but what actually it means and how we can leverage on these topics to provide better care to our patients. So if you use three words, accreditation, quality improvement, and patient safety. So these three titles, if I say so, are actually interrelated. They are not seen in isolation, but they are to be seen in interrelation. And how, I would just tell you in a moment. Now, if you look at it, accreditation, which many of the people now are aware of, because accreditation system exists for last 18 years in India, when it started in 2006 by NABH. And if you look at this, there is a framework of standards, which is basically comprised of structures, processes, and outcomes. So any accreditation standard talk about these three components. So what are the structures required? What are the processes to be put in place? And how you measure your outcomes. And so accreditation play a very important role in helping and supporting quality improvement and patient safety. And by doing so, it really helps organizations to have a continuous oversight on their operations and therefore ensuring the operational sustainability, whether it's terms of human resources, in terms of finances, or anything else. When we talk about quality in healthcare, What is quality? Quality is a perception. It varies from person to person, organization to organization, based on experiences. So it's basically a philosophy. It is defined by the users. So, but WHO has defined quality as you can see on the screen. It has components, several components, seven, eight components critically. The first is safe. So the care which is safe is quality care, okay, which means it avoid harms, minimizes risks, and also injuries, which are very much preventable, which are very much avoidable, and therefore reducing the errors to the healthcare provider. And it is effective. So providing services in a manner which is based on evidences, which is based on scientific knowledge, is effective. It is timely. So, no unnecessary delays in providing care to the needy patients. It is efficient. So, it's not just effective, but efficiency is also equally important. So, how quickly you can deliver the service, maximizing the use of your resources and reducing the waste. So, it's safe, effective, timely, efficient, and equitable. It means it is available to all those who need the help care without differentiating based on gender, race, geographical location, or any socioeconomic status. So everybody should be having a equal right to access acute healthcare. It should be integrated. It should not be seen in isolation. That diagnostic is talking about its own, then surgical team talking about its own, and medication team talking about it. So no, it needs to be integrated, which means the care delivered to the patient is such that they are talking to each. All facilities which are related to that specific patients are talking to each other. So they are well coordinated. They are, and that's why it become more efficient and more effective. And it's people centered. What people centered means, it means the patient in the center and the family around and then community. So it's not just treating a disease in an individual, but it's about the person. It's about the people who are receiving care. And so we need to understand individually what are their needs. There may be different needs of the same type of ailment suffering people. They may react differently to your medication. So they need to be taken as individual, as a person, as a people, so that they can receive the care what they need. It's not just everyone receive the same. It's a simple example. When you prescribe a medication, usually the dose is per kg of weight, body weight. So you can't prescribe same dose 500 mg for every patient. You consider whether the patient is how much weight it is. So neonate is different, the pediatric patient's different, adult different. And obviously within even adult and pediatric is weight. Even pediatric can be 50 kg, 60 kg, and need more doses. So it's not just one dose for everyone. It's very specific to individual. So it's the high time, and the world has already moved around people-centered care or person-centered care to have more efficient and effective and safe care. So as we move from the accreditation framework and then moving to the care, the quality of care in healthcare, and then patient safety. So patient safety by WHO defined as you see on the screen, patient safety is a framework of organized activities that creates cultures, processes, procedures, behaviors, technologies, and environments in healthcare that consistently and sustainably lower risks, reduce the occurrence of avoidable harm, make errors less likely, and reduce impact of harm when it does occur. So what does it mean? It means there are several errors happening in healthcare system, and most of them are very much preventable, very much avoidable. And that's the pity. If we know they are avoidable, why we are not taking actions to avoid them? And if it happened for some reason, how we can reduce the impact of that harm on that specific patient. So we need to have a whole ecosystem to deal with such situations so that the care given to patient is safe. It's not unusual. People keep reading on newspapers or on TV or social media what happened because the eye care is a high risk business. It's a left eye or right eye. You know, left kidney, the right kidney, left arm, the right arm. So it's like that. It is into that category. So we need to be very careful. And people know that left eye operated upon instead of right eye. These are not just philosophy; they are realities, which happens uh, here and there around the globe. So how we can take these things into consideration when we develop our healthcare systems and deliver by healthcare organization. So accreditation is used as a mechanism to support quality improvement and patient safety. Why? Because it's focused on self-evaluation, it focuses on self-assessment, the real one. It's not just you tick, 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 not that one, the real one you do yourself. See where you are in terms of standard compliance, whatever standard you choose to go for. Okay. And it's based on the external evaluation process, external evaluation, third party evaluation done by an accreditation body. So it's third party evaluation process which is most robust, unbiased compared to first and second party audits and assessments. And the most important component in this is there is a commitment and involvement of the leadership. The leaders decide that they want to go for accreditation. It means they want to go improvement cycles. They know that they need to involve the staff. They need to engage with the staff to get the better outcomes. And then in the last, how you engage with your patients and their families to understand, to deliver people-centered or person-centric care. So as you see in the red box, most of the harms are avoidable, very much preventable, most of those. So how accreditation support? It supports to improve quality. It supports to increase safety of patients. It supports in reducing the risks to your systems, and also it helps in changing the management. So change management is very changing the mindset of the leaders or the managers is very, very crucial in order to gain the benefits. And how it all works, how it all works, you know. So the most important thing that I just mentioned is the governance, the managers, the leaders, the governing boards, the CEOs. So they need to be involved in that. They need to understand it. And then human resources, the people, whether they are skilled, appropriately skilled, where they are appropriately trained, where they are in adequate in numbers. And then obviously facility, infrastructure, whether it's a equipment, physical environment, or any other thing, which means information system, how you make sure your data or information which you collect is actually meeting your need, meeting your requirements. And obviously the patient, various processes and procedures being carried out on patients. And so how in general, how this system works? So it works in improving communication, collaboration, and team building. It helps in bringing the higher level of integration in the services being offered in an organization. It helps organization with critical path to achieve improvement. So it's about identifying problems, looking for solutions, finding ways of implementing those solutions, and then see how they result into improvement. So just to give the audience an oversight, what is happening globally in terms of patient safety, if you're not aware of. So WHO is doing a lot of work in patient safety for last around 10 years, doing for many, many years, but for last 10 years is very integrated, very intense exercise going on, which resulted the General Assembly, WHO World Health Assembly agreeing to recognize patient safety as a very challenging area to build into their plan, which further resulted into creating Global Patient Safety Action Plan 2021-2030. We fondly call it a decade of patient safety. And so the right side, if you look at the cover page of this document, the Global Policy Action Plan, you can download it from WHO website. It talks about how to eliminate avoidable harm in healthcare. Any type of healthcare facility, whether it's a clinic or a hospital or whatever it is. And these are the strategies how these need to be tackled at the government level, the national government level, how it can be tackled at the facility level, at a hospital level, how it can be tackled at the individual level, at the staff level, and on so on and so forth. So the need is fostering collaboration among stakeholders for better outcomes. So without collaboration, without integrated approach, we cannot achieve what we talk. It's just it will be talk only, not be resulting into action. So if you look at this slide, it talks about holistic integrated approach of care delivery. If we want to do things right, if we want to make sure our patients are safe in our healthcare system, then we need to work together. So patients, the healthcare workers, the managers, the facility managers, policymakers, and civil society or patient organization, these five pillars need to work together. They need to work together in such a manner that they listen to each other. Policymakers draft the policies, taking the feedback from all of these entities. Similarly, as facility managers also need to integrate their system, looking into the feedback from patients, feedback from staff, and so on and so forth. So this is the whole integrated approach if we really want a safe care to be delivered to our patients. Sorry. So how standards support healthcare facilities in attaining their own goals for quality improvement and patient safety? It helps increase the reliability of diagnosis and treatment. So when they increase the reliability of diagnosis and treatment, obviously it reduces the variability in diagnosis and treatment. When the variability is reduces, standardization increases. So people get better outcomes and the waste is avoided. Now, for all these activities, or what the philosophical thing I just mentioned to you all, how the accreditation standard help, you know, saying something that we should be doing these things, but where from we get the guidance, where from we get the direction, where from we get the wording for policy, and that's why the standards come in. So if you look at this slide, as I mentioned, we have four sort of standards, four types of health and social care, eye care organization. So this is one of the framework from ambulatory care facility for daycare surgery. But the framework remains same, only the difference comes in terms of number of standards or in terms of number of criteria. But the framework overall remains same, except for a region center because they are actually not in the clinical side. They are actually a little more towards social, clinical come social sides, and a very smaller entity. So we have not all those things in built into that standard. But otherwise, these are the 10 chapters. So if you look at the 10 chapters, they talks about everything about an organization starting from the governance downline to human resources, the facility, clinical protocols, infection control, so on and so forth. So in our daycare surgery centers for eye, 10 chapters, 71 standards, and 268 criteria which they need to implement. So if you look at the governance and leadership, it's about that how high eye care facility require a governance structure. Without a governance structure, and a governance structure does not necessarily mean that you have to have a corporate board structure. It's just it's a structure that yes, these are the people, one, two, three, maybe, who are actually the leaders, the governing board, who makes policies, who drive the organization, who provide direction to the organization. So it's entirely based on the size of the organization. You need not to have a 10, 15 member of the board of directors or so on and so forth. It's not that. So governance can be anything which provide directions to the organization in order to offer safe and quality care. And usually it comes from the legal identity. Depending on the legal identity, you may have the structure and also the leaders and the management of this organization also make sure that they comply with the minimum and applicable legal, statutory, or regulatory requirements to that specific organization. For example, whether you have a license under Clinical Establishment Act, do you have fire safety norms in place, do you have Atomic Energy Radiation Board for diagnostic imaging, where you have a radiation safety protocol required. So whatever is needed to specific type of activity, they need to be in compliance with that. Similarly, for human resource management, this asks us what you need in terms of human resources. How many you need, you define. What qualification you need, what skill set you need, what experience you need, how many you need, you doctor, nurse, paramedic. You define how many need, and then work out what are you looking in there, how you recruit them, how you get them. After you get them, how you train them, orient them to the organization's activity so that they can discharge their responsibilities more efficiently and effectively. And then how you make sure that on a continuing basis they develop their professional development, all these things. So this is about human resources component. Similarly, for facility and risk management, it talks about that the physical facility, the physical environment is safe for the people, whether it's staff or visitor or patient. It also takes care of all sort of potential hazard, health and safety aspect for everyone around it, and also the equipment. What are the equipment you needed? Are they properly maintained? Are they properly calibrated? Are they properly handled? And information management system. Obviously, most of the critical things comes here. It's about how you collect information, how you store information, how you retrieve information, how you disseminate information, and how you dispose of information when you no longer require it. So it's all about your forms format, whether it's digital form or is it paper based. So it's entire up to the facility whether they want to be electronic completely, or they want to be paper based, or they want to be hybrid. Continual quality improvement focuses more on indicators that you define your indicators, whether it's a managerial indicators or clinical indicators, monitor them, make the analysis of those collected indicators, and make use of the results, outcomes for further improvement. Otherwise, you won't know where you are heading to. And this is the basically the clinical standard patient assessment care, where you assess the patient when patient comes first to the organization. You assess for their needs, and based on that assessment, you prepare a care plan. And based on the care plan, you start treatment. Okay, and then you follow the care plan. And if you need to modify care plan based on the outcomes or the progress of the patient, you can modify. But it is essentially asking you to document a care plan, and everyone should follow that. And it also goes around, several diagnostic processes which are required for the specific patient. Similarly, now patient rights and education, one of the important thing, patient has certain rights, rights to confidentiality, rights to privacy, rights to refuse care, rights to second opinion, right for cost. There are several rights listed out. The organization must know and also communicate to the patient in a manner and a language patient understand. They need to be provided maybe on the boards, on the brochures, or verbally communicated the way you like. But they should be properly communicated in a manner and language they understand. Medication management, very important chapter, because globally medication errors are happening abundantly. Second second most important cause of medical errors is medication error, whether it's related to prescription, whether it's related to dispensing, whether it's related to administration. At all these three stages, errors are happening globally, whether to accept or not, but there are. So that's why a lot of focus from WHO comes for medication safety. And it's very, very important for healthcare facility to really focus on medication management system, that how they write, how they prescribe, how they transfer from one place to another place, how they identify patient, how they identify medicines, and dispensing protocols, high risk medication, look-alike, sound-alike medication, and ultimately the administration to the patient. Then surgical care and safety is again is talks about the surgical procedures, which is based on evidence-based, following WHO checklist for safe surgery, which is very, very important. Uh, and the environment condition, the operation theater, the sterilization of the equipment, the stability in the environment, how the air changes of operation theater are happening, how you are monitoring the infection protocols within the operation theater. So all those things come under surgical safety and care. Last but not the least, hygiene and infection control is very important, starting from basic hand hygiene practices, so that you need to have a policies and procedure for infection prevention and control. The staff awareness and training is very important to take care of these things, and infrastructure to support IPCs, whether in terms of operation theater, in terms of engineering controls, other in terms of PPE provided to people to maintain, and all whatever monitoring systems required for surveillance of the environment in terms of IPCs. Quickly on the Vision Center, as I mentioned, the fourth standard which we had recently developed basically is one of the minimum requirement we have identified as uh, to be there in a Vision Center, to be called a Vision Center for accreditation purpose. And these are listed on this slide, starting from visual acuity check, anterior segment examination, intraocular pressure check, posterior segment spectacle lens power, and so on and so forth. So these are the minimum thing which a vision center must have if they are interested in accreditation. The last three, teleconsultation, low vision services, and fundus imaging are desirable. So they are not essential but desirable. But rest of the services and activities must be performed in a VC to be called. In addition to VC, we have a component in facility and risk management chapter about green component. So if there are environmentally sustainable practices being adopted, and if a center has those things, comply with those requirements, we can also call that a green vision center when we issue an accreditation certificate. So that takes care of green component as well. Now, coming to quickly to accreditation process, any eye care organization interested in accreditation from QAI for all type of facilities for like small eye center, big eye center, daycare centers, or even vision center, uh, self-assessment based on the standards. Then there is a set of documents and application form they need to fill and submit, which we review, and then we carry out the assessment. So assessment can be on-site, hybrid, online, depending on the situation and type of assessment we are carrying out. And then after that is done, we review the report. If there are any gaps identified during assessment, the organization is giving time to take care of. It is 90 days to close those gaps and come back to us with evidence of corrective actions, which are reviewed by the accreditation committee, and the accreditation committee give recommendation for accreditation or otherwise. Once the accreditation is recommended, a certificate is issued by the board, signed by chairman and the CEO. It is valid for 3 years. And then there is a mid-cycle in 15 to 18 months, there is a surveillance assessment conducted. The difference between the process of eye care organizations, whether daycare or inpatient, with Vision Center is that in Vision Center certificate is issued for 4 years, and the surveillance is done in 2 years instead of 3 year cycle. It is a 4 year cycle. There's a difference between these two set of standards. Now, coming to the end of my presentation is talking about future trends in healthcare. As we're talking about a lot of artificial intelligence, machine learning, evolving technologies, and several integrations. So, if you really want to make sure that the care which AI organizations are delivering are safe and are of high quality, they need to be innovative. They need to be using smart technologies. They need to be collaborating. Collaboration does not always mean outside collaboration within the organization. Collaboration with people, the patient, the visitor, the community, government, other stakeholders, anyone. If you see what can bring a value to your system, and persistent focus. And without deviating focus, you should be quite persistent in defining your strategy and target, and then persistently following it up through. So these are the future trends which are going up and gaining momentum, supporting high quality and safe care to the patients. With this, I would like to thank you. Thank you, Vision 2020 India, and thanks to all the participants for giving me patience hearing. and I would be happy to take any question from any of the delegates present here. Thank you very much. Over to you, Hina. Thank you.
So there are few questions. The first question is, please elaborate on the requirements of RMO and nurse-patient ratio for daycare eye hospital.
Okay, so as you know, that as per nursing council requirement in India, there is a ratios given with number of beds, like in general ward 6:1, and in ICU 1:1, and in private ward 4:1. And then there's a cycle. We define 8 hours or 12-hour duty rosters, and then accordingly you should have numbers. So that ratio has to be maintained. Okay, whether it's a daycare or there are patients. If there are patients admitted even during daycare, you need to have that much of nursing strength. And in terms of RMOs, again, for RMO there is no, but it depends on the workload and the availability. So as you define, it's basically uh, important is that are you able to deliver your clinical care efficiently and effectively? So whenever patient needs a doctor, a qualified doctor, the doctor should be available. That's how you define. There is no specific formula or calculation which can be arriving at the number of RMOs you need in a hospital, whether it's a daycare service or even inpatient service provider.
Okay, thank you, sir. So the next question is, where do you get standards and how to become auditor?
So QI standards can be secured by sending an email to us, as mentioned in my last slide, and even you all have the email ID. So you just send an email ID using to our email ID a request that you want a set of standard, whatever standard you need. You just send an email, and we will send you a PDF copy of standard. If you need a paper copy, there will be charges for that, but for PDF is no charges. And to become an assessor, we use the word assessor, not auditors. So we conduct two types of training program. One is for internal assessors, we call internal auditors, which people can help their own organization and to prepare them. And another set is for assessors, which we as an accreditation organization uses them for conducting assessment. So we have defined qualifications and experience requirement for becoming an assessor, whether it's a eye care organization or a vision center, because the requirements are different for both. And we advertise on our website and social media. So whosoever meets those requirements can apply for those training program. So that's for assessor, but for internal auditor, we call it implementation DIPE program, documentation, implementation, verification, and elevation DIPE program. Anybody can attend. There is no qualification or experience requirement. So please follow up on our website or social media to get the updates on these. Thank you.
Okay. Thank you, sir. Next question is, any specific guidelines for the operation theater related to modular laminar with HEPA, etc.? Is any mandatory clause?
Okay, so in the chapter in facility risk management, as well as in infection control, we talk about these. So we do not say that you need to have a modular OT. This is a modular OT is a term basically. So we do not define that you need to have a modular OT. You need to have a proper audit or operation theater, operating room, which which ensures the sterility in the operating table. Okay. So there are guidelines which we have published. We call QA guidelines for operation theater. You can download a copy of download guidelines from our website, which basically talks about air changes happening, how many fresh air, how many recirculated air changes happening in the operation theater. So please download those guidelines from our website.
Next question is a daycare unit nurse patient ratio.
It's the same thing as that was the first
Yeah.
question.
Mhm.
Because during daycare, basically mostly they are the general ward, or if you have so the 6:1, when you have rooms, then special ward or what you call it private ward 4:1. So it's up to you how you manage. So for daycare, is not much requirement prescribed, but obviously for inpatient there are. But regulation is same whether it's daycare or inpatient. So I think for daycare services, smaller one, I think couple of nurses based on number of beds you have, for daycare are sufficient.
So, thank you all for attending today's webinar. We appreciate your time, engagement, and thoughtful questions. A special thanks to our speaker for sharing their expertise. We hope you found the session valuable. Thanks again and have a great day.